Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
Joining me in the studio today is Professor Frank Meyer. He's a specialist in sports medicine from the University of Potsdam. Welcome.
Hi.
So you try to stay healthy, work out, exercise, and then you're punished for this. Is exercise a bad idea?
Basically not. Exercise is pretty fine just to increase health and to stay healthy. In this shown case, it's just considered as an accident, and this doesn't take that often place. It's just kind of a side effect of physical activity, and so it's kind of an incident that is not very often.
So the patient in our film was obviously too ambitious when she started doing exercise. What shall I do when I start training again?
Yeah, so the question is, what do you mean by too ambitious? Of course, the recommendations are to start slowly, just to start with the basic exercises and then to increase intensity and duration of the exercise, and then you are able to reduce the risk of injury.
What are the most common causes of sport-related injuries anyway?
Yeah, so the most frequent injury itself, it's the ankle sprain, and the ankle sprain is very often when you do some cutting maneuvers, when you have high external load on the ankle joint, and then you might suffer from an ankle sprain. But again, this is considered as an accident.
Back to the muscles, especially amateurs often suffer from strained muscles. What is a strained muscle?
Yeah, this is not quite easy to explain. You have to differentiate between a strained muscle and a sore muscle and a really torn or injured muscle. And if you just suffer from a muscle strain, then you consider it as a very low, severe injury, which might long for about 2 weeks. In contrast to a torn muscle fiber, where in most of the cases it just takes you 6 weeks to go back to play.
And shall I just go back if I just have a sore muscle? Shall I just continue doing my sports, or should I pause?
Yeah. You have to consider that also differentiated. When you suffer from an acute injury, then there is kind of an acute therapy regimen. We call it RICE. It's rest, ice, compression, and elevation. It means that you just reduce the swelling and you reduce pain by ice and by, for example, compression or kind of a bandage. When you suffer from a sore muscle, you are allowed to go on with the muscle, but just on a moderate intensity.
How can we best prepare for an exercise? Is a proper warm-up very necessary?
Yeah, proper warm-up is considered as beneficial for to reduce sports injuries. And of course, you can prepare yourself by doing some home workouts like strengthening with the own body weight or sensory motor training, because it's pretty well known that if you do nothing, that then the risk of injury is quite higher as if you just prepare yourself before you start with sport activities.
Professor Meyer, muscular imbalances of underdeveloped muscles often lead to joint damage. How can you balance your muscles?
Yes, this is quite a difficult question because there is almost no valid definition of what muscle disbalance or imbalance is. So if you consider it as a non-coordinated or non-balanced muscle force that is acting on a joint, then you can consider it as a deficit of functional stability of a joint. And of course, injury rate is higher when, for example, knee joint is not stable during sports activities. So if you consider it in this case, you have to increase the performance by strengthening the muscle and by the so-called sensory motor training, which means an improvement of postural control and balance.
We do have a viewer question. Chetan Chay from India wants to know how you should behave if you have a torn ligament.
Yeah, so if you have a torn ligament in the ankle joint, for example, of course, the acute situation refers to what we said before. And then if we just follow the rehabilitation course, it takes you about 2 weeks just to reduce the swelling, the pain. In most of the cases, you will wear an orthotic brace. But after 2 weeks, you should start again with physical activity, in most of the cases guided by a coach or by a physiotherapist. But at least it will take you 6 weeks till you can forget the whole story and go back to sports activities.
The world is full of excuses, especially for not doing any sports. So couch potatoes often say, I don't want to go jogging because I can damage my joints. What do you say to them?
I can't agree, because it's pretty well known that the injury rate, especially in running, is low, and that the injuries that occur in most of the cases are small overuse injuries, and they are not pretty severe. And what is very well known, that you just can protect your joints, the bones and the tendons when you exercise and when you go out for running, and that the risk of an injury for those structures is higher if you don't do anything.
Great. Thank you, Professor Meyer, for being here and giving us these insights into sports medicine.
Thanks again.